MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
Good morning, Dr. Libby. Thank you for joining us live here at the American College of Cardiology. There's a lot of discussion happening around cardiometabolic risk, and you're part of a new organization. Could you tell us a little bit about?
Well, the International Chair for Cardiometabolic Risk is an organization that was founded to try and increase the level of consciousness among medical professionals and among the public in the magnitude of this problem and how the elements of the metabolic syndrome and the attendant cardiovascular risk is really not only affecting adults, but I'm afraid there's an epidemic of childhood obesity that is now spreading worldwide, and that I see as actually an emergency, a public health emergency, because we're sowing the seeds for a coming epidemic of cardiovascular disease. You know, we're so proud that we have made inroads in cardiovascular disease with our contemporary therapies and prevention over the last few decades, but I'm afraid we're going to backpedal if we don't make major efforts to stem this tide of cardiometabolic risk. That's going to require not just the traditional medical model of the doctor one-on-one with a patient and trying to convince the patient to follow a healthy lifestyle and, when appropriate, to take medications. I think that we need to mobilize the profession as societal leaders, as community leaders, to try to make changes on a societal level, not just on a one-to-one medical model kind of intervention. You know, I went for a run this morning here in Orlando, and it's very hard because there aren't sidewalks. We are designing a society that engineers out physical activity that requires you to have a car in order to get around and discourages you from being on a cycle or walking or running. We're withdrawing support from the public schools for physical education. What kind of message are we sending our young people, and what kind of a health consequence will we bear down the road? So the International Chair has a website, organizes meetings, and tries to preach the gospel of prevention as a response to what I view as a medical and public health emergency.
And what can physicians around the world do to be more engaged with the International Chair if they'd like to participate?
Oh, well, go on our website. We'll flash, if you would, the URL of the website with this video, and that will outline not only our activities, but also provide you with access to resources, including slide collections for teaching, for your own education, and for you to get out and disseminate the message so that we can try to work together to stem this tide of cardiometabolic risk that's sweeping over the world.
Thank you very much.